Even if states gave the president his one-year delay, Paul Raczkowski wants to know what happens after that. Now, he lost his health plan because of the new law, and he's not really encouraged by some of these changes being discussed now. Explain what happened to you, Paul.
Well, first, as soon as the Health Care Act was enacted, my premiums went up twice in 1 year, so I decided to get a catastrophic policy. And then I recently got a letter that said my policy was canceled.
So the times
the
times they went up, the first time and the second time, how did they explain why they went up?
They didn't explain that. They just went up for whatever reason. But it happened to occur right after the affordable health care was enacted. It became less affordable. And I actually changed to another company, and I went just for a catastrophic plan with a low premium, high deductible. Now I have a choice to get the same plan, which is double.
Double?
So, and I have to do that by January.
All right. I don't mean to get personal, Paul. You don't have to answer this. Do you have any pre-existing conditions or something like that that would warrant a doubling in your premium?
Absolutely not. I'm very healthy. That's why I went for the catastrophic.
Gotcha. So how was that explained, why the premium would have to double? That's more than like a 10 or 15% or 20%, as we've seen sometimes among people on the show. That's big.
They just said because of the new Health Care Act, it was going to be doubled.
Did you have
or
a,
that it
what,
would be
did you have a
canceled,
substandard plan? Yet, as the president had been calling them plans that didn't cover everything they should, or what?
What? Yeah. Well, it was a catastrophic. I got 2 visits per year with a $40 copay. I got a free physical every year. You know, and it was a low premium, and that was my choice to get that type of plan. Now I have 4 choices if I want to go on the government site, and those are double that price as well for the lowest plan, and that's with a high deductible. I think that's a $5,000 deductible.
Holy Toledo.
So.
Yeah. When you hear from the administration and others advocating the health care law, whatever your political views are, they say that cases like yours are the exception. They're not the rule, that far more will benefit and pay less than folks like you who are getting zoomed and paying a lot more. What do you think and what do you say?
I think that's wrong. I mean, I don't make a lot of money, and you know, this is just limiting my freedom. I think the president told us that we could keep our plans. And I think he just lied. I think he lied to push, you know, the health care through, you know. And I think it hurts everybody in the long run. I think this isn't going to help anybody at all.
Are you able to take advantage, if these insurance commissioners approve it, of a 1-year extension the president first proposed?
Well, I don't know, and I don't understand how that's going to happen. I mean, who's going to pay for all this paperwork and all the...
Good point.
You know, those are just words. I don't believe that...
Amazing.
You know, I think there's a lot better choices to create a free market and let the insurance companies, you know, open up. Right now we have 4 choices, from what I can see, and it's limiting everything. And now I have to pay for maternity and a lot of other things that...
Amazing. Amazing. Hang in there, Paul. Thank you for sharing your story, though. You're not alone, because we're hearing a lot more just like it. In the meantime,